Hello, everyone. The big question on everyone's mind is school reopening, and if so, what will it look like? I wish I had the answers to those questions, but I certainly don't. But what I'd like to do in this presentation is to tell you all of the thoughtful planning that is going into a potential reopening. We do expect school to reopen, but we won't know for sure until mid-July. In order for public schools to reopen in New York State must be in phase 4, and we expect that the governor will make that announcement approximately July 14th, July 15th. As I mentioned, we are engaged in an extensive planning process. Hours and hours, days and days, most of which actually began in the spring. So I'd just like to give you a little taste of that and an overview of what this process looks like. And I expect after we hear from the governor in mid-July to come back to you with our plan for reopening. So we have 4 guiding principles that we have been holding as our goals throughout the process. And you can read them here. But as you see front and center, it's about the academic, social, and emotional learning of our students, and of course within a safe environment. We are following the guidelines presented to us from the Centers for Disease Control, Department of Health, and of course New York State. We are focused on sharing expectations, sharing communications with all of our stakeholders through this process. And most importantly, we have been including district and community stakeholder partners as part of this planning process. As you see, we are in the beginning of July, and we are working on all of our plans. We have been holding regular discussions with the Board of Ed and small groups of board members. And if you see those white asterisks, they refer to the District Community Stakeholder Group. The District Community Stakeholder Group is comprised of 35 people representing all the stakeholders in Edgemont, some who work within the district and some community members who have expertise in medical professions, health and safety, as well as infectious disease. So since we don't know exactly what we will face when we return to school, we have been working on 3 different scenarios. First is all students return to school with social distancing and health protocols in place. The second is a hybrid model. We don't know exactly what that would be, but we're working on a couple of different versions of that, looking at how many students can be in school at any one time and spreading students throughout the entire school building. So for example, gymnasiums would be used for classes, and any type of physical activity would be social distance and would be held outdoors. And the third scenario, all students engage in e-learning. So that's how we ended the school year, and that's a scenario we are looking at as a possibility, especially as we hear about concerns as we go into the flu season next year. So here's a representation of all of the people and all of the committees who have been hard at work in imagining our reopening. We have 11, you see 11 committees in the yellow rectangles, and that important stakeholder group at the bottom in green that I mentioned. So the stakeholder group, as I said, 35 people, mixed representation, including experts in organizational reopenings of learning and reviewing plans from other states and other countries. And you see our committees who have been working. We have a very active academics group which started work I guess it was probably in the spring, the academics group started. It was a continuation of the work we did to get ready for e-learning, and then looked at what we can offer to the students, what has been made available through the summer, some book groups that we've started, and you should have recently received an email from Michael Curtin about that. That's an example of one group that has been working, and the composition of that committee is teachers, administrators, and the director of curriculum and instruction. You also see the medical group that has been hard at work. Our school physician and our nurses have been collaborating. We were very happy to recently read the report by the AAP, the American Academy of Pediatrics, and have been working to order additional equipment as mentioned in that report. Each committee that's at work is working on a reentry worksheet. They are listing the task, the protocol and plan. This is an example from the mental health and psychologist perspective, looking at how we support students. Again, no matter which scenario that we are functioning under, our mental health practitioners and our school psychologists have been hard at work. And again, that work also started in the spring. Here's a little bit about the stakeholder group. I started by telling some of it. I mentioned about the 35 people. So here is a little bit more about them. And if you look at the questions we started with, the first time we met, we started with those broad questions on the left in terms of norms of operation, current guidance, how do we structure facilities, and what has been a great outcome of that stakeholder group is we've developed subcommittees or sub-meetings to help us really drill down. And in fact, I participated in one with the medical group yesterday so that we could really understand what we're going to have to do for a safe return. So I thought this might be a good opportunity to remind all parents whose young children might not yet be familiar with wearing masks. Summer might be a good time to find a mask that works for your child, maybe play with the mask, have a little bit of mask time, because we do expect come September we will still need to be masked, the students as well as all of the faculty and staff. So it's a good time with your young ones who maybe haven't been wearing masks if you haven't been out and about much, but to start getting them familiar with masks. You can also see regarding the questions in terms of the medical perspective, we are still learning a lot about quarantining. We are all back, all of our district office and school office staff are back for the summer. We have a no visitor policy unless, of course, you have an appointment, and we will be following all social distancing and masking protocols this summer. So in closing, all of our groups, the 11 committees that are working, the stakeholder group that will meet and give us feedback, have been very active and very helpful. The more people who are involved and the more subgroups we create, the more information we get that will actually inform our plan. So we recently heard that we will hear from the governor probably mid-July, July 14th, July 15th, about New York State moving into Phase 4 and what Phase 4 will mean. At that point, we will continue our draft plan. We plan to meet with the stakeholder group on July 10th to share our draft plan. At that point, even before we know, we originally thought that was going to be after the governor. In fact, I'm thinking now as I'm speaking, we might have to move that stakeholder group back a little bit further to give us an opportunity to respond to the governor's message about reopening. I will just go back to that. All of the groups that are working, if you think about everything that has to be considered regarding athletics, regarding building operations, health and safety, our protocols for coming into the building. During the summer, all of our employees are responding to a screening questionnaire before they come to work every morning. So those are all of the pieces that have to be in place for a safe reopening. I look forward to holding some parent forums so I can hear from you directly. They've been scheduled for, let me just find that, been scheduled for Monday, July 6th at 10 a.m. and the link is on our district website. If you go under the last Edgemont e-news that I mailed out, and the second parent forum will be held on Tuesday, July 7th at 7 p.m. So I do look forward to continuing the conversation, to hearing your questions, to hearing your concerns, and to make sure that we are addressing all of those as we work to safely reopen Edgemont schools. And now I will turn it over to Board of Education questions. Thank you.